Howdy everybody, welcome back to my Poop Tip Tuesday. Hope you guys are having a great week. Thank you guys for joining me today. So for those of you guys who are joining for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. My passion is to give you guys tips and tricks to help out with your health. Every Tuesday, I go live to answer questions you guys may have, whether it's questions you sent me via DM, email, or anything else, or even live questions you're asking right now. So a couple of administrative things. Number one, if you haven't already, don't forget to smash that like button. Like, share, and subscribe. Number two, let me know where you're watching from. Are you watching from Lubbock or around town? And let me know also if you're watching live or on the replay as well. And if you haven't already, don't forget to subscribe to a weekly newsletter. I give you great tips and tricks, topics that I think that are good for you to help out with your health. I'll put a link down below before we begin. Hope you guys are having a great week. So for me, this week's been a little bit stressful. I am getting ready for my new clinic. There are so many things that we have to get done in the next couple of weeks, but the tentative plan for us to open is going to be January 11th in 2021. I am so excited. I'm excited about the new space, better parking. I'm excited about what options we can have for our patients. So please, if you are one of my patients, come follow me, come see me. And if you are a patient that wants to see me for the first time too, come see me as well. I'd love to see what else we can do to help you out. So now that we have that, let's go and start with some of the questions people ask me. So first question is from Richard Gonzalez, who said, "Hey, Dr. Islam, what can someone do about flare-ups when it comes to hemorrhoids?" All right, great question, Richard. So hemorrhoids suck. Yes, they do. They're a little pain in the bottom for a lot of different people, and they can cause symptoms like pain, bleeding, itching, or pressure, a lot of gut issues as well. It can be really discomforting to have that. Now, there are a couple different options that we can do to get those hemorrhoids taken care of, and there's three main options I want to talk about. Number one, which is what a lot of people do, is more medical options. So they're over-the-counter treatments for hemorrhoids, whether it's witch hazel, maybe it's hemorrhoid creams, maybe it's other things like that, like sitz baths, making sure that you soak your bottom, things like that. These are very effective temporary fixes when it comes to hemorrhoids. Now, also whenever you have hemorrhoid issues, you have to make sure that you're flowing and you're not having issues with constipation. So try to add some fiber, maybe add some Miralax as well. This is some of the more conservative options that you can do, and this can sometimes help out with some of the symptoms when it comes to hemorrhoids. There are prescriptions that we can prescribe for our patients, including sometimes if there is a fissure or a tear, we can give you a nitroglycerin ointment. Sometimes we can use some steroids as well in your bottom. But these, once again, are only a temporary measure. They don't fix the actual problem. And once you have issues with hemorrhoids, there's a very good chance that they can come back. But these are some things that we recommend for our patients to try and do at home if they cannot get those hemorrhoids fixed. So let's talk about the other options. There are two ways to mainly fix them. One is the one that we do called hemorrhoid banding. The other option is to get them surgically fixed. So getting your hemorrhoids surgically fixed by a surgeon sucks. It is terrible. It is painful. It is not fun. It is not anything that you want to go through at all. It is a very hard procedure, mainly because that area of your bottom has a lot of nerves, a lot of blood supply. It's very difficult to heal, which brings in the options that we do for our patients, which is hemorrhoid banding. This is a very effective, safe, and for a lot of our patients, it is a painless procedure. We place a small little rubber band around the hemorrhoid. It strangulates the hemorrhoid. You feel the urge to poop or maybe some pressure in your bottom for about 24 to 48 hours. Then eventually those hemorrhoids go away. And once again, this is a fix for hemorrhoid issues if you ever have problems with hemorrhoids. But if you can't do that or you don't want to do that, we do have some of the more medical options. They work okay, but they're not the best options, but they certainly are better than nothing. Great question, Richard. Michelle, it's great seeing you. Thank you for watching. Again, Dolores, great seeing you as well. And Irene, good seeing you guys. Thank you for watching on the live stream. And thank you for commenting on that particular, on my Facebook Live and my YouTube Live as well. All right. Question number two. Hey, question I got from Daisy. Hey, Dr. Islam. What are your thoughts on dietary supplements? Oh my goodness, all the rage. People love to use dietary supplements to try to maybe get improvement with their weight with the New Year's coming on and people having resolutions, want to get healthy and maybe lose some of those extra weight that you may have gained during the pandemic. A lot of people turn to dietary supplements as a means to get that done. What are my thoughts about that? So number one, let's just say this. They don't typically work very, very well. Unfortunately, the data doesn't seem to suggest they'll make a significant difference at all when it comes to weight gain. And in fact, there are a lot of dietary supplements that can actually cause harm to you. People don't realize that these dietary supplements have a lot of caffeine. They have a lot of thyroid hormones. And these things can really jack up your metabolism and make it feel like you're actually losing weight, but you have other symptoms like anxiety, heart palpitations, you can't sleep. It's just not good for your overall body. Number two is that there's a very good chance that these dietary supplements actually do not have the ingredients that they say on the ingredient label. And there are a lot of studies to suggest that when you actually look at the dietary supplements that you can get, you actually cut them up in a laboratory and you compare what you see when you cut them up to what is on the ingredient label, there is no correlation whatsoever. There's nothing, the things that are in the actual tablet themselves are not on the ingredient level, and vice versa as well. So who knows what you're actually ingesting when you have a dietary supplement. Number three is that they're not regulated. So any Joe Schmo can set up shop and say, hey, I'm going to give you a dietary supplement. It works. I have studies that say that it works, but no one can say no. No one can regulate against them. And there's nothing that you can do about that because it's not a regulated industry. Number four, people don't realize this, is that there are certain interactions that can occur with the medications that you take. And so be very careful of that. This can make some of your blood pressure medications maybe not work as effectively, maybe work too well. If you're on a blood thinner, it may make problems with that as well. And if there could be interactions that you may not be aware of. And then lastly, number five, I mentioned this earlier, but they frankly do not work. They really don't. At most, you may lose maybe 1 to maybe 3 pounds, but guess what? As soon as you stop that supplement, you're going to get that weight back. That even includes the weight loss that you could be having with a prescribed medication to help you lose weight. The data is not so good. So how exactly do you lose weight? It simply comes down to diet, and then exercise. The vast majority of weight loss really comes down to diet and making sure that you can have a good diet, a diet that's low in calories, a diet that's low in processed food, and a diet that's high in protein. These are kind of the tricks that we use to hopefully allow you to lose weight. And then if you can add exercise on top of that, that's like extra, a cherry on top. But by far, the most effective thing that you can do to lose weight, if you want to for 2021, is to really watch what you're eating. It really comes down to that. There's no shortcuts when it comes down to it. That's really the biggest thing that you can do to help you lose the weight that you want to lose. Heath, great question. I'm going to answer that question very soon. And Cruz, it's good seeing you as well. And Ashley, thank you for watching on the live video. So I want to talk to you about a case that I read of somebody a long time ago, almost 1,000 years ago, who was mummified, who actually had a colon that was 6 times the upper limit of normal. And so I saw this recently in which a scientist found a fatal case of constipation in a 1,000-year-old mummy. Yes, this mummy had a colon that was 6 times the normal size of the type of colon that we have, and it was full of stool, almost 2 to 3 pounds of stool. And unfortunately, it looked like that this mummy passed away from such severe constipation. And so what are my thoughts on this? So this, what actually happened is that this mummy got infected with a parasite, and this parasite caused a condition called megacolon. And this megacolon literally is what it sounds. Your colon becomes huge, it becomes massive, and it gets to a point where you can't use the restroom, where you actually have obviously issues with constipation, and it can lead to death. So does that happen right now? The answer is yes. It is a rare complication, but there is a infection that does occur typically in South America, and that can cause you to have a huge entire big colon because it affects the nerves of your colon and it does not allow them to work. And because of that, you can actually have a colon that stops working. And yes, you can have a condition called megacolon. It is not common. It is very rare. And this is obviously not a thing that we hear a lot about it. But a lot of people ask me, hey, Dr. Islam, I have constipation am I going to have my colon tear from that? Now, that is a very uncommon complication when it comes to constipation. It does happen, but it's very uncommon for that to occur. And obviously, there are a couple things that you can do to hopefully get your bowels going, whether it's fiber supplementation, maybe some magnesium, maybe eating some kiwi. There is some good recent evidence to suggest that kiwi can actually help improve constipation as well. Maybe you want to take a laxative as well. These are things that can help you go through. So, summary of the story. Number one, megacolon is real. We found it in a mummy, and we see it even in current day. It's very rare, very uncommon to occur, but if it does occur, usually it's due to an infection that you get, typically in South America. It's very uncommon or rare to die or have your colon tear from chronic constipation. However, there are ways that we can use to hopefully figure out what's going on and hopefully allow you to treat what is going on as well. Sean, it's good seeing you as well. Mary, it's good seeing you guys. Thank you for watching on the live stream. I appreciate that. All right. Question number 4. I got this from China Beach. I don't think it's your real name, but it's okay. So China Beach asks, hey, Dr. Islam, would you know if stringy stools can be related to anxiety? So let me know in the comments below. Have you noticed a correlation between what you feel up here and what goes on in your belly or your colon? Let me know in the comments down below if you've noticed that, because I know with the stress that's going on, with the pandemic, prior with the election, with other things that are going on inside the world, people are very anxious right now. They're very stressed. They're very worried about what is going on. And a lot of people can manifest that inside their gut. And let me know in the comments if you've noticed this or if you know somebody who's had this as well. So yes, the answer is very true. You can have stringy stools or a change in your bowel habits from what's going on with inside your brain, whether it's anxiety or depression. It's called the brain gut axis. There's a connection, almost a highway, direct highway between here and what's going on inside your gut. And that can manifest as diarrhea, constipation, reflux, bloating, upset stomach, those butterflies that you feel in your stomach as well. This is all a real phenomenon to have, and a lot of patients have issues with that. And so sometimes the treatment for what's going on in your colon may be treating what's going on right here. And there's a lot of good evidence to suggest that maybe treating the underlying depression, anxiety, stress will help out with your gut. And commonly in our patients who have a condition called IBS or irritable bowel syndrome, one of the first line treatments that we do are medications to help relax the colon, whether it's a low dose antidepressant or a low dose medication like that, because not only will it fix what's going on right here, but it'll fix what's going on right here. So yes, that is true. However, one thing I do have to stress by far is that if you're having a consistent change in your bowel habits that is not associated with what's going on up here, or it hasn't gotten better, this is a sign for you to see a GI doctor. There could be something else going on. There's something that needs to be evaluated, and there may be something we need to figure out what we can do to make sure everything else is doing okay. So make sure, guys, that you do get that taken care of. Oh, Ashley, thanks for my cup. Yes. So that cup is one that my daughter made. So I appreciate that. All right, last question. So let me find it here. All right, so Dr. Islam, yogurt. I have heard a lot of things about yogurt. Does it cause diarrhea? Does it make diarrhea worse? Does it make diarrhea better? What are your thoughts on yogurt? All right, this is a great question. It's a very confusing question because a lot of people have different manifestation when it comes to yogurt. So what is going on with yogurt? Well, yogurt tends to have what are called probiotics. Probiotics have been shown in some, not a lot, it's not a huge thing, but some clinical trials to helpfully help out when it comes to gut issues, whether it's diarrhea or loose stools or changes in your bowel habits. This tends to do that. And there's some evidence that suggests that yogurt can sometimes carry those probiotics that are on there. And for some people, that can help out with some diarrhea issues, whether it's diarrhea from taking an antibiotic, diarrhea from IBS, or diarrhea from any other conditions. Now, there are certain strains that you want to look for probiotics to make sure that it is good for you. And you need to make sure if you do take a yogurt that it does have these strains. Number 1 is lactobacillus. Number 2 is bifidobacter. And number 3 is Saccharomyces. These are the 3 strains of probiotics that have been shown in clinical trials to help out when it comes to gut issues. Now, specifically to yogurt itself, we do not have a lot of good evidence that eating yogurt is going to give you enough probiotics or to help out with your gut. Now, there may be a section for everybody, but in general, we don't have that evidence for that. Two main reasons why. Number one is that you typically need about 10 billion CFUs, which are colony forming units in some sort of probiotic to give you the best effect. Yogurt doesn't tend to have that. But also number two, a lot of probiotics and yogurts included in this get broken down in your stomach, and that is not where your bacteria lie. Your bacteria stay in your colon. And so if you're going to find a probiotic that's going to be better for you, you want to make sure it bypasses the stomach acid, because that will break down what is going on. Now, let me give you a big spiel about probiotics. I personally do not take probiotics at all. I don't take them at all. I do take prebiotics, and that is very, very helpful when it comes to your gut. So if we think about a hierarchy of what we can do to help improve our gut, number one, adjusting your diet by far is going to be the best thing that you can do for that. Number two, lifestyle changes will make an improvement, whether it's better sleep, better stress. Number three, taking a prebiotic instead, which is part of the lifestyle and diet changes, will help out. And a distant fourth or fifth, maybe taking a probiotic. So some people may benefit. The data is not really there. It is more hype than anything else. But we've also noticed that sometimes yogurt can cause diarrhea. What's going on? Let me know in the comments down below if you've noticed this, or if you had anybody who suffered from diarrhea with taking a probiotic. Here's the issue, is that yogurt can sometimes have dairy in them. And that dairy will cause diarrhea to occur, and that diarrhea will make you have a lot more frequent gut issues and bowel issues. So that is the issue right there, is that because it has dairy, you may not actually realize that you're lactose intolerant, and that may be the reason why you are having loose stools as well. So these are my thoughts on yogurt as an option for diarrhea. All right, I want to answer some live questions, but before we do that, I want to ask a favor. So one of my goals for 2021 is to see what I can do to improve my live videos, or any comments or suggestions you guys may have. What I would really appreciate from you guys especially is let me know in the comments, or send me a message, send me an email. What do you like about the live videos? What would you suggest I change about the live videos? And number three, any other suggestions you would add on to the live videos. I'm really hoping to ramp up my game in 2021 to get more people to watch, to get more people to enjoy it, to give education to everyone, to help out with their gut issues. So please let me know what I can do to improve what is going on. Thank you guys. All right, so let's answer some questions here. So Heath, great question. Will too much fiber make you constipated? Starting a clean new diet. Number one, Heath, I want to congratulate you on starting a new diet. That is fantastic. So the answer to your question is potentially yes, it can do that. So, when it comes to fiber, it's very difficult for us to know exactly how everyone's going to recommend. Here are my thoughts on fiber. Number one, pick a soluble fiber. Very, very important to do that, whether you're having diarrhea or whether you're having constipation. 3 soluble fibers I recommend. Number one, wheat dextrin, which you can find in Benefiber. Number 2, guar gum, which you can find in any health food store as well. And number 3, make sure that the fiber is as natural as it can. Try to not find fiber that's full of other ingredients. My next tip when it comes to fiber is to go low and go slow. You need to take your time when you're taking your fiber. Don't just all scoop all that fiber in there. You're going to get bloated, distended, gas. You're not going to feel very, very good. So go low and go slow. And then just see how your response is. Some people may just need a little bit of fiber. Some people may need a lot of fiber. But the great thing about fiber is that it's a natural prebiotic. Yes, you see that? It's a prebiotic, which is going to help out with your natural gut microbiome and improve what's going on. So Heath, I applaud you for doing what you're doing. Try to see if you can adjust your fiber. Try the fibers I recommend as well. I will tell you, you will notice the difference, because I have when I add my prebiotic fiber there. All right, let's see what else. So B, good question. Do you find any problems with your patients taking Miralax daily if needed? Very good question. So A lot of people get concerned about Miralax and about the concerns about getting used to it or getting your body, slowed down because of it, or, getting, I don't know, a slow colon. Here's what you need to know. Number one, that's completely not true. So there is no clinical evidence that your colon will slow down, will get used to it. You'll have a sluggish colon if you take Miralax every single day. Miralax is a very safe and effective medication. It works, and it works very, very, very well. And so there's typically no problem with that. Having said that, though, I want to stress that if you are having a new onset constipation, you need to get that checked out. Or if you're having constipation in general, you need to get that checked out as well. But if you want to try something else instead of Miralax, taking one of the prebiotic fibers does work really, really well. Sometimes adding some magnesium will work as well, but obviously make sure you discuss with your healthcare provider about whether that's the best option for you. It's a very good question. Perfect. So Susan, Miralax. All right. So I think we kind of talked about that briefly, but Miralax is safe. It really is. It's been used for a long time. It's a very safe medication. You typically will not get used to it, and you typically will not have any problems with that as well. Once again, though, make sure you get further investigation to find out exactly why you're having that. Oh, Michelle, love this question. Great question. Do nuts or seeds cause diverticulitis? Okay, I need to know down below if you've heard this or not. Let me know, because I hear this all the time when it comes to my patients who say, hey, Dr. Islam, I was told to avoid seeds, nuts, popcorns, things like that. So let me know in the comments if you heard this, because you ready for the answer? Brrr, drum roll, please. The answer is no. There is no evidence at all that seeds, nuts, popcorns will increase your risk for diverticulitis. This is a very common question, but the answer is no. So what I tell my patients, hey, if you love popcorn and you love seeds and nuts and you have had diverticulitis in the past, it's all good. Go crazy. Enjoy yourself. Here are some things that I recommend diet-wise when it comes to improving diverticulitis. Number one, we do know that a diet that's high in red meat does increase your chance for diverticulitis. Number two, we also know that smoking increases your risk for diverticulitis. Number three, we know that taking anti-inflammatory medications, Aleve, naproxen, Advil, Motrin will increase your risk for diverticulitis. And number four, we know that a diet that's high in vegetables will decrease your risk for diverticulitis. These are the things that you need to do more importantly than avoiding things that like nuts, seeds, popcorns, which have no chance of causing diverticulitis. Great question. I love it. I love it. I love it. Very common question. All right. So a couple more housekeeping things. So number one, once again, my clinic is going to open January 11th. Please, I would love to see you guys in that clinic. If you are a patient of mine, there is nothing you have to do. Just show up. I'll be there. You don't have to worry about insurance, referrals, any all that stuff. It's all going to be the same. And if you are a new patient, I would love to see you. I'm taking all insurances, including First Care and Covenant. Let me know what we can do to help out with that. And also, number two, one favor I need from you guys, let me know in the comments or send me a message what I can do to level up my live videos, what I can do to share what I can do to hopefully make these better. I'd love to hear your suggestions. I'm trying to improve what I can. And if you haven't already, please smash that like button, share, and subscribe. Guys, after next week will be 2021. Have a happy new year. Be safe, be healthy. Thank goodness 2020 is finally over with. Hope you guys have a happy and healthy day. Take care, everyone. Thank you.